This lecture will discuss the development of the limbs. What we want to consider during this lecture is where the different structures that are found in the upper and lower limb come from, and begin to talk about the factors involved in limb development. The limb is a classical system that's been used to really define a lot of the developmental paradigms involved in embryology. As we go through, we'll also remember where the skeletal muscle and the nerves develop from and how they get to the limbs. When we look at the development of the limbs, we can consider that during the 4th week, around day 31, a limb bud appears. A couple days later, the hand actually appears. It appears like a paddle. And by day 36 of gestation, chondrification begins. At day 54, fingers are separated, the limb is present, and ossification begins. So at that point, we need to consider bone formation and growth of the long bones. When we talk about the development of the limbs, we're looking at contributions from the paraaxial mesoderm, which will give rise to the skeletal muscle, and lateral plate mesoderm, which will give rise to the connective tissue, bones, and cartilage in the upper limb. Again, you remember the paraaxial mesoderm gives rise to the somites. There are 42 to 44 somites, and the somites give rise to myotomes, which develop into muscles. For the limbs, the C5 through T1 myotomes will contribute to the muscles of the upper limb. The L2 to S3 myotomes will contribute to the muscles of the lower limb. So, to begin, at 4 weeks the limb buds appear, and their appearance is signaled by a thickening of the ectoderm, which covers a core of mesoderm where the cells have begun to proliferate. The ectoderm becomes pseudostratified in appearance and is called the apical ectodermal ridge. This is a picture from Dr. Kathy Sulick's website, and in it shows the beginning of limb development where a bud just is appearing. And in it, we can identify several of the axes that we need to talk about when we talk about limb development. We can talk about proximal versus distal. So there's a proximal distal axis in the limb. There is also anterior and posterior axes, anterior being on the radial side or the thumb side, posterior being on the ulnar side or little finger. And then there is ventral and dorsal. Ventral being the flexors, dorsal being the extensors. One of the signals that people are looking for is what actually triggers this ectoderm and underlying mesoderm to be involved in limb development, both for the upper limb and for the lower limb. And while the signals are not clear yet, it seems that TBX5 and TBX4 for the upper and lower limbs respectively do play a role in at least identifying the ectoderm and mesoderm of the regions of the limb buds. In addition, we can identify by some of the Hox genes another relationship where the upper limb starts with a particular constellation of Hox genes, while TBX and the Hox genes do not cause limb development. They signal a region where that development is proceeding. So we can talk about the development of the limb bud and refer to the development of the different axes. When we talk about the proximal to distal axes, we have to talk about the apical ectodermal ridge, because that is going to initially influence the underlying mesoderm. One of the ways it influences that mesoderm is that it takes the mesodermal cells beneath the apical ectodermal ridge, and those cells begin to proliferate. So there's a progress zone that develops. And in that progress zone, there are proliferating and undifferentiated cells, and that's a necessary zone for limb development. As the cells leave that progress zone, they will then begin to differentiate. The influence of the apical ectodermal ridge has been known for some time. Classic studies have shown us that if that apical ectodermal ridge is removed, the limb bud will stop developing. So if it's removed early, the limb won't develop at all. If the apical ectodermal ridge is removed later, some of the more proximal structures will develop, but the more distal structures will not. So that it is a time-dependent organization from proximal to distal as to the origin of the different structures in the limb. Now, people have been searching for what the apical ectodermal ridge contributes that allows for this proximal distal development, and it has been shown that fibroblast growth factor is important in limb development, in that if one removes the apical ectodermal ridge and now replaces that with a bead soaked in fibroblast growth factor, then limb development will proceed normally. So the apical ectodermal ridge is producing fibroblast growth factor, which is influencing the underlying mesoderm. Now, that's not to say that the mesoderm isn't important, because initially the mesoderm is what's going to influence the overlying ectoderm. And so this is a classical situation where mesoderm and ectoderm are going to reciprocally induce each other. So the mesoderm first secretes fibroblast growth factor 10, and that contributes to the apical ectodermal ridge formation. As we said, without the apical ectodermal ridge, limb buds will not develop. After the apical ectodermal ridge develops, then fibroblast growth factor 4 and 8 are going to, from the apical ectodermal ridge, are going to maintain that progress zone of the mesoderm. Without FGF4 and 8, cell death occurs, and the distal structures will not develop. So the apical ectodermal ridge is producing fibroblast growth factor 4 and 8 that allow for the progress zone to continue to develop. Now, in terms of dorsal and ventral polarity, what we know is that there are, again, differential expression of genes that allow for this polarity to develop. Radical fringe is expressed in the dorsal ectoderm, and engrailed is expressed in the ventral ectoderm, and these help to determine the polarity in the dorsal ventral axis of the limb bud. And so engrailed is important in the flexor or ventral compartment formation, and engrailed represses the WNT7A. WNT7A is important in the development of the dorsal compartments of the limb bud, and one of the ways that happens is that WNT7A induces LMX1 in the underlying mesoderm. So you can see the complexity that's developing in terms of developing this limb. Finally, we can talk about the antero-posterior axis in terms of digit formation and radius and ulnar formation. Important in the anterior-posterior patterning that occurs is the zone of polarizing activity. The zone of polarizing activity is going to influence the overlying apical ectodermal ridge. This zone of polarizing activity is located in the posterior part of the limb bud. Again, if we go back to some of the classic experiments that were done on limb, what was found was there was this area called the ZPA, zone of polarizing activity. If it was present, normal digits would appear. This is a representation of the chick bud, limb bud, and you can see the 3 digits that are appearing in the normal limb. Several different types of experiments were done. They removed the zone of polarizing activity and the digits did not form. Another experiment that they did was add a second ZPA in the anterior region of the limb bud, and when that happened, there was mirror image duplication of the digits, so that now you had extra digits forming, and they were a mirror image of one another. What's in ZPA? Well, it's been found that the cells in the zone of proliferating activity produces retinoic acid.